Welcome. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Climate Change and Health series, a special collaboration between the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next, I would like to introduce you all to our guest speaker. Joining us today, we have Dr. Sue Ellen Brakey. Dr. Brakey is Distinguished Teaching Associate Professor in the School of Nursing and Associate Director of the Center for Climate Change, Climate Justice, and Health at the MGH Institute of Health Professions in Charlestown. Her clinical background includes global health and critical care nursing. Dr. Brakey teaches in the Doctor of Nursing practice and accelerated BSN programs with a focus on ethics, evidence-based practice, and population health. Joining us today, we also have Dr. Patrice Nicholas. Dr. Nicholas is Distinguished Teaching Professor and Director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the Co-Director of Policy and Advocacy in the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science in Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. They join us today to give a talk on the intersection between climate change and malnutrition and health. So please join me in welcoming them.
Thank you, Amy. I'm just going to share my screen here. And can you see that? Okay, great. Okay. So I also just wanted to acknowledge my colleagues, Patrice Nicholas, who's here, and who I'll ask to, come off mute when we get to the Q&A, and Barbara Belanger, who is a nurse at Mass General, who is also part of the Center for the Environment and Health, an OR nurse who's very interested in sustainability. And so Patrice and I have been conducting this series. And then also I just want to acknowledge Amy, because it's really great that we have this collaboration and we're able to get the word out to community members and patients and clients about the impacts of climate change on health. So today we're going to talk a little bit about the intersection between malnutrition and climate change on health. And it's pretty fascinating yet alarming information. So the number of, from a global perspective, the number of extreme climate disasters that harm agriculture has doubled since 1990. And so this in and of itself leads to increasing global food insecurity, and much like everything, low-income countries are hit the hardest. An estimated 820 million people are undernourished, and 2 billion people face food and nutrition insecurity. And it's important to note both food and nutrition insecurity, because sometimes people are, they have food, but the food that they have isn't nutritious. 76% of the world's population get most of its daily nutrients from plants, which I thought was interesting because that's not the case in higher income countries for the most part. And this extreme heat and worsening air pollution, floods, droughts, the things that we associate with climate change will lower crop yields. And in general, globally, without even considering climate change, 1 in 5 deaths globally is attributable to poor diets. So the Lancet Commission, which puts out they put out the Climate Change and Health Report based out of England. They, in 2019, published a paper, it's more than a paper, a report on the global syndemic of obesity, undernutrition, and climate change. And so the definition of a syndemic is 2 or more diseases or pandemics with 3 characteristics. They co-occur in time and place. They interact with each other at biological, psychological, or societal levels, and they share common societal drivers. And so this concept of a syndemic was used initially to really talk about what occurs at the disease level in an individual level. But the authors of this paper used it to look at the intersection between these pandemics. So the pandemic of climate change, the pandemic of malnutrition, obesity, and undernutrition. And then interestingly, this report was put out before the global pandemic, which we know the global pandemic also contributed to health outcomes and intersects with climate change as well. So what this report states is that malnutrition, and again, including both obesity and undernutrition and other dietary risks, is the leading cause of poor health globally. And so when we think about obesity, we think about the risks related to non-communicable diseases like diabetes and heart disease. And when we think about undernutrition, which really, for the most part, is more prevalent in lower middle income countries, we think of kids in particular and how undernutrition impacts them. The major drivers of this endemic include food and agriculture, transportation, urban design, and land use. In 2015, obesity was estimated to affect 2 billion people globally. Now, if you remember on the last slide, I said that 2 billion people were also facing food and nutrition insecurity. And so then, so there's some link between these people who have obesity and who are also food insecure and nutrition insecure. Obesity and its determinants are risk factors for 3 of the 4 leading causes of non-communicable diseases. And as I mentioned, cardiovascular, type 2 diabetes, and certain cancers. The Intergovernmental Panel on Climate Change, which is what the IPCC stands for, predicts that the biggest threat to health from climate change will be undernutrition because of its impact on food and agriculture and food systems. So the relationship between undernutrition and obesity is important to note. And so undernutrition in early life is a predictor of obesity in later life. And this is related to fetal and infant undernutrition, food insecurity, as we've talked about before, and then also poor quality, poor diet characterized by a low variety or access to healthy foods. So an example, and this is still from the Lancet report, there are several Middle Eastern countries, which I didn't name here, but they include Iran and Egypt and Saudi Arabia. These countries have a high prevalence of adult female obesity and female child and adolescent populations who are underweight. And so that's kind of showing this relationship between undernutrition in the early years with obesity. And so, for instance, they describe how it's not uncommon to see people who have stunted growth who are overweight. And that's an example of the impacts of both of those factors. This might be a little bit difficult to see on your screens, but what this is showing is just a comparison of prevalence of female obesity. Now, why they're picking female, I'm not quite sure. It could be because females in general are more at risk for health issues globally. But female obesity, underweight in girls ages 5 to 19, carbon footprint for those countries, GDP for those countries, and then I'm not sure if I'm saying this right, but the Gini coefficient, which is a measure of economic inequality, where the higher the Gini coefficient, the higher the inequality economically. And so if you kind of follow this chart, you can see, for instance, about halfway down, high income English speaking countries, excuse me. And you can see that the prevalence of female obesity is 33%, which is very high, but our prevalence of underweight is pretty low at 6% because, you know, we have access to resources that low and middle income countries may not have. And then our carbon footprint is very high at 18.5, higher GDP and pretty high Gini coefficient. And then if you look at, for instance, Central Africa, they have a prevalence of female obesity of 9%, but underweight is high, and their carbon footprint is very low. And they also have a pretty high economic inequality index. And also you can see that the GDP per capita is low. So this chart is just really was interesting to me because it really points out the larger injustices around both climate change when you look at the carbon footprint across these countries, and then also just the lack of economic resources and infrastructure and how that impacts health. So the food system, when we talk about nutrition, malnutrition, you really have to think about the food system as a whole. And so that includes not only agricultural production, but storage, processing, distribution, and consumption. And so across all of those 5 areas of the food system, there are losses and waste. And the issues resulting from issues in each of those pieces of the food system include waste. A third of all food produced is not eaten. Nutrient losses, food safety and access, and climate change. And then the drivers of the food system include demand, economics, legislation, and climate change. And so you can see that climate change appears in both the consequences of the food system and also the drivers. And that makes a lot of sense because within our food system, climate change is a driver in that there are places in the world that are losing access to nutritious food because of the impacts of climate change. And so if you think about sea level rise, drought, high heat areas, this is actually impacting certain countries or regions' ability to create a sustainable food system that will help them achieve, an appropriate nutritious status for their population. And so what that means is some of these places are then dependent on having food shipped in, which can oftentimes be very or under nutritious. And an example that we've used in the past is the Marshall Islands, where because of sea level rise, they are unable to create a sustainable food system for themselves. And so they rely on a lot of food that is imported in, and a lot of it is unhealthy, things like spam and processed foods. And so that is a good example of a population where they, because of their limited access to nutritious food, and in part because of climate change impacts, they are seeing more non-communicable diseases like cardiovascular disease and type 2 diabetes, etc. Current food systems produce more than 1/3 of greenhouse gas emissions globally. And that was pretty astounding to me. And one of the one paper that I looked at, and I have it in the references, said that's greater than all the cars on the planet. And this is global because this is a global, climate change is a global issue. And so we do have to think about kind of how we impact the rest of the world. And so a lot of this greenhouse gas emission production comes from meat and dairy. And livestock alone, out of this 1/3, accounts for 12 to 19%. And we know that there are, more livestock and more dairy is consumed in higher income countries. The other thing that contributes is just the modernization of the process of the agricultural process is much more modern and generates greenhouse gas emissions as well. What I found really interesting is that 75% of the world's food comes from 12 plants and 5 animal species. And so there are more species, but in terms of what we tend to use in terms of our nutritional habits comes from a very, very small subset. And the issue with that is that as changes in biodiversity occur, land loss, the inability to, grow nutritious crops, we will have more and more dependence on other sources that we might not be necessarily using now. And so the term agrobiodiversity is defined as the diversity of plants, animals, and microorganisms that directly or indirectly support food and agriculture. So that includes those that provide pollination, and we all know that we're having an issue with bees, and they're, hopefully, but they're risk for extinction, and how important that would be to our ecosystems and our ability to grow nutritious plants, nutrient cycling, pest control as well. And so we have to, the Food and Agriculture Organization has stated, achieving agrobiodiversity is critical to creating healthy diets and agro ecosystems. So this overdependence we have on few plants and species really threatens our sustainability of our food system, which I found to be really fascinating to learn that we are so heavily reliant on such few sources of nutrients. So in terms of food, where do food-related greenhouse gases come from? And so we know, again, going back to meat and livestock, methane is a large component of greenhouse gas emissions related to nutrition, to food. And while carbon dioxide is the most prevalent atmospheric greenhouse gas, methane is really important to note as well, because it hangs around for considerably longer. And so it has a longer length of time that it's creating to global warming. The other thing to note is that red meat and processed meat not only create significant amount of greenhouse gas emissions, but they also use a lot of water, cropland, and fertilizer. And when we think about water, that is already another source that can be that is being threatened by climate change, and is, you know, a scarcity in currently in some countries and on some continents. And then cropland. So the more cropland we need, the more we're contributing to deforestation. And so, you know, trees and vegetation actually serve as carbon sinks to, you know, absorb carbon dioxide from the atmosphere. And so as we cut down these, you know, our vegetation to create more cropland and more land for livestock, then we're actually, you know, creating more warming, because we're not able to, you know, you have these carbon sinks be as efficient. Nitrous oxide is released from fertilizers, and that's another important thing to note, that nitrous oxide is also, while it's a much less prevalent emitter, it also stays in the atmosphere for a longer time and creates, you know, more global warming. And then, as I mentioned, CO2 from deforestation, use of fuel, manure management, and rice cultivation also contributes to greenhouse gas emissions. This is a picture that just shows the kilograms of greenhouse gas emissions per kilogram of food. And you can Google kind of a similar thing if you wanted to look at your own carbon footprint. Like, this is actually one way that it's visualized, but it can also be visualized in other ways as well. So what you can see here, which is visually striking, is again the degree to which beef and livestock contributes to greenhouse gas emissions. And then again, to just point out that, of course, it's really the high income countries that are consuming beef predominantly. But you can see lamb, shellfish. There are shrimp farms which have also been, you know, created, which also kind of take away from the vegetation that could contribute to kind of serving as carbon sinks. And so that's problematic as well. The other thing is that a lot of areas, fish is being, you know, what's the word I'm looking for? We're overutilizing certain areas. And so it's actually contributing to, you know, decreases in certain fish and shellfish because we're over farming those areas. You can see pork, poultry, and then as you can see, the more plant-based things have lower greenhouse gas emissions. It is important to note that one of the papers that I cite, that I referenced in the slides here, which I'll give to Amy, talked about a survey that was done with people to see if they eliminated, or if they tried to eliminate meat from their diet, what would they substitute that with? And a lot of people said like cheese or dairy, which is good, but also still contributes to greenhouse gas emissions. And so they weren't necessarily identifying plant-based food as a substitute for meat in terms of protein intake. In terms of nutritional losses related to climate change, so there are a few things that are happening with climate change. There's changes because of CO2. There's changes because of higher temperatures. There's changes in terms of the extinction of different species. But there are also changes to the inherent nutritional makeup of food. And so this was a study done by Sam Myers, who is he's the head of the Planetary Health Alliance, which is actually located here in Boston. They did a study looking at what was the nutritional makeup of food that was grown in areas with higher, and this was a study that they controlled, but when they increased carbon dioxide and they increased temperatures, it not only did it decrease crop yields because the conditions weren't great, and of course, if you have drought, etc., but the nutrient value of the food decreased. And so zinc, iron, and protein concentrations decreased in wheat, rice, and legumes. And they were looking at the levels that they used were levels that are predicted, CO2 levels that are predicted in 2050. And then what they determined is the reasons are unclear as to why there are decreases in the nutrient value of food, but they believe that it could possibly have to do with those conditions actually create accelerated growth of certain plants. So if the crops are growing, even though the crop's yield is decreased, they are growing in less time because it's warmer and because of the CO2. And so this is actually not giving enough time for the plants to produce micronutrients. And so that's why one hypothesis as to why they are less nutritious. So sustainable food systems is really what the answer is, but we haven't, and it will take a lot of work to get there. And again, thinking about this not only from a national kind of perspective, but also thinking of it globally, what really comes into play are all the inequities that are already present, and again, impacting people from those who least contribute to greenhouse gases are impacted the most in terms of ecology, inequities, economics. And so sustainable food systems would promote those ideals and would also have a lower environmental impact, support biodiversity, and contribute to food and nutrition security, which, as I pointed out earlier, is a huge problem in and of itself, not to mention when you combine that with the impacts of climate change and how that's going to impact food access and security and nutrition. And sustainable food systems would also importantly support local food cultures and traditions, which is really important. So the Lancet report talked about what is needed for this to occur, and how should we be addressing this major health threat, this major looming health threat. And actually the health threat is here, but only going to get worse. And this is a quote from them: coordination of individual movements, such as those that address poverty reduction, environmental sustainability, climate change, food sovereignty, social equity, hunger prevention, livable cities, safe neighborhoods, health food environments, rights of the child, and good governments. So that's a tall order. And definitely, thinking about livable cities and safe neighborhoods. When we think about malnutrition, obesity, and undernutrition, again, it's not only about food access, but it's about access to healthy foods. People who are impacted in terms of obesity tend to be people who have access to, more transportation. And so really looking at transportation, the built environment, and trying to place emphasis in addition to sustainable food systems, but also thinking about how can we also facilitate and optimize people's health with physical exercise, and in addition to addressing food access and security, but also thinking about other things that impact health. And that we know that in countries that are becoming more modernized, they are seeing higher degrees of non-communicable diseases like diabetes and heart disease, because they are relying more on transportation, for instance. So while that is a tall order in terms of what we should be doing, like at the policy level and the international level, one way that we can all contribute is to think about shifting towards a plant-based diet, which is, again, for many of us who live in high-income countries, this is difficult because we do rely more on meat and meat products. But and the other thing is there's a lot of personal there's a lot of personal beliefs and values that are tied up in food in all cultures. And it's also in terms of like how you how do you do this? And if you're the only person in your family who decides to switch to a plant-based diet. But what you can do is just take measures to move in that direction without going there completely full speed ahead. And so these are just some suggestions that I took this off the Harvard website, and the link is below, but just increasing your vegetable intake, change the way you think about meat. I like this one. It's a garnish and not the centerpiece of the meal. Which again is very difficult. I can remember a few years ago going to San Antonio, and Texas is an area that is very tied up and bound up with meat. That's part of the culture of that region. And I can remember getting a salad, and it was just, well, what's your meat? And I was like, I didn't want any meat. So it's really even within our own country, thinking about regional differences and how we look at food differently. Choosing good fats, cooking vegetarian at least one night per week, with a concentration on beans, whole grains, and vegetables, including whole grains at breakfast, and adding fruit, adding greens to your diet, which a lot of these things I think people know, and we see this, and we know when we go to the grocery store where the emphasis has shifted. Building a meal around a salad, eating fruit for dessert. And so what are the benefits of a plant-based diet? Calorie density. And so there's more. The foods, eating plants and vegetables, fruits and vegetables, they are more calorie dense foods, and as well as, legumes and nuts. So they have less calorie for the level of their density. So they fill you up more without increasing your calorie intake. It contributes to a healthy gut microbiome, weight loss and control, improved heart health, prevention, or kind of reversal of type 2 diabetes, cost savings for the average family. And then this doesn't really go along with cost savings, but I put here back in terms of the water expenditure, 2,000 to 8,000 gallons of water are required for 1 pound of beef, and 1,950 gallons of water for 1 gallon of cow's milk. And so that just gives you some perspective on how this is impacting the environment. If people in the United States ate meat or dairy-free for 1 day a week, meatless Mondays, a lot of us have probably heard about that, then it would have the same environmental impact as taking 7.6 million cars off of the road. Micronutrients in plants do have less bioavailability, and so that is something to consider. So for instance, if you're getting certain proteins from meat, they're just more available to your system to utilize, and they can be less in plants, and that is dependent on the plant. It's plant dependent, so it's not across the board, but it's something to note if you're on a plant-based diet, which some of you on this call may be. And then it's also important to note that not all plant-based diets are healthy or have the same environmental impact. So for instance, if you go plant-based, but you're also consuming a lot of, sugary foods or foods that aren't necessarily healthy, or they're still processed, then that is not only not healthy for you as an individual, but it also doesn't have, it's not as good for the environment. Just because it's not meat, it still has impact on the environment. And this was, I think this is, I have this resource in your resource list, but there was a study that was just, I think this was just published in 2022 out of the Harvard School of Public Health, and they looked specifically, they used the Nurses' Health Study 2 to look at people's diets, and they then looked at the environmental impact specifically between healthy versus non-healthy plant-based diets, and they did find that plant-based diets that are healthy do have a better impact on the environment. So it's interesting because there's a lot of work that's being done in this area, a ton, and this is an area that I know less about, but as I was doing the reading for this, it was fascinating. And I did provide some resources here. Again, you can Google and you'll be able to find tons of stuff out there on plant-based diets and the like, but lots of lay resources, not just scientific materials. But these were 3 that I thought looked kind of interesting. The one I just talked about, the environmental impact versus healthy and non-healthy plant-based diets. And then the first resource I thought was a nice overview, which is just a beginner's guide to a whole food plant-based diet, if you're interested in that. And at that, I'm going to stop, and I'll stop my sharing.
Thank you, Sue Ellen. Such an interesting presentation, and I think it's such a great precursor to next month's climate change series, when Barbara Belanger will be talking about MGH's Food to Waste Sustainability Program around food waste and not having it go to landfills, which we know contributes, as you beautifully stated, the linkage to food waste and climate change. I also think it builds really well appreciation that we had environment and health and the MGH's Climate Center around, as you noted, overfishing is a problem. So as people may think, I'll eat healthier and have fish rather than beef or another meat, that in fact fish supplies are being depleted. And as we had that session on kelp farming as a great source of protein and the fact that it can be successfully built in the oceans and offer nutrition for the world's people. So that was great.
Yeah, Patrice, that's good to bring up the kelp farming webinar that we had, because not only is it a good source of protein, but kelp also serves as a carbon sink as well. It actually pulls carbon out of the atmosphere, and which I found very interesting. And there are actual kelp products out there, like kelp burgers and whatnot, that people that they're high in protein, but people can, if they're interested, can kind of Google that. And I wish I could remember the name of he actually gave the name of a product, and I can't remember what it was. But so that is really interesting. And I think it's also important, I didn't really say this explicitly, but because of the warming of the ocean, there are species in the ocean that are becoming extinct. And there are areas, for instance, like I think oyster farms in New York that are not really, productive because they're not suitable environment for the oysters to be growing anymore. So there's really this, it's a complex link between food systems, climate change, and nutrition, for sure.
And when you talked about over farming of fish,
It's
would that
interesting.
apply to all fishes or a particular type?
Shrimp is a big one. It's there. I'm not specifically sure about, there are regions where there are fish that are being over-farmed. I think it more depends on like what grows in your particular region.
And then the other part of it too is as the oceans warm, some fish species move north. So, for example, lobster fishing used to be very successful in the Rhode Island area. That's been migrating north to Maine. And there are also regulations to protect certain species, like whales, for example, that impact fishing for certain species that also tie into the complexity around having available fish sources.
You had referenced the Lancet report. Is that available publicly, or does one need a subscription to access and view them?
I'm just looking because I thought I put it in the references. Yeah, I did. But if you Google it, the Lancet report, nutrition syndemic, it comes up, and you can access those. You can download the PDF. And they typically, all the Lancet reports typically come with an executive summary, and then they launch more in detail into like each area. So if there's a particular piece that you wanted to look at, it's like, so for instance, I didn't really get much into their policy recommendations because they're very like high level, and I just wanted to bring it back down in terms of what individuals can think about doing, even though we know that individual actions don't make the biggest dent in greenhouse gas emission reduction. It's still important to think about, even if it's from the standpoint of like, we all are stewards of the planet.
And as background for the audience, the Lancet Countdown reports on climate change have been published in October, November, or early December every single year since 2015. And those Lancet Countdown report on climate change, and those will come up. The most recent one was subtitled Health at the Mercy of Fossil Fuels. And the year before it was subtitled Code Red for Humanity. And those, as Sue Ellen mentioned, they're very comprehensive reports, but you can get the executive summaries. And Dr. Renee Salas, who's an emergency department physician at Mass General Hospital, is the lead co-author on the U.S. briefs for the Lancet Countdown reports for the past couple of years.
Thank you. You had touched a little bit upon plant-based diet, some tips. Do you have any additional tips you can share for those who are primarily meat-based, want to consider transitioning? Are there any tips that you can share on making a slow, sustainable transition?
I think because I am not 100% plant-based, so I don't want to make it sound like I'm, I don't want to advocate for something that I'm not doing as well, but I have made some steps. And so I think an easy thing is the meatless Monday. I mean, whether you want to do it on Monday, but one day a week of just trying to avoid meat, I think is very doable. As is, thinking about portions, and that if you put more vegetables on your plate than meat, that makes a difference. And I think the other thing that I know I've really tried to do is limit my food waste. And so what that has meant for me has really been, to just go to the store a little bit more often and buy less, which isn't necessarily great from an economic standpoint. I understand, like, if you have a big family, but I think just trying kind of some of those small ideas that fit into your lifestyle too. I mean, it's like with dieting, you can't really shift everything because then it won't be sustainable to continue. But I mean, I think the meatless Monday thing is something that is work, and especially given what we know about the impact of meat on the environment and health, of course, as well.
And I know Dr. Nicholas had provided us with like a little sneak peek of next month's session, but what is Mass General doing to address these issues in support of sustainable food systems? Anything else in addition to what Dr. Nicholas had mentioned?
You're on mute, Patrice.
They're definitely working on composting, and that makes a big difference, that food waste doesn't go to landfills. And Barbara will have a great presentation on that in March. The other thing that Sue Ellen touched upon are the co-benefits of moving towards a plant-based diet, which are certainly heart health for sure, as well as less likelihood of cancer risk and as a co-benefit.
Aside from being more mindful, switching to plant-based diet, reducing waste, at a local level, what can we do?
Well, I think you can go to your town hall webpage and see what kind of sustainability efforts are happening in your town, and get involved on that level. I mean, even if it's, and again, these seem small, but like the rain barrels that towns will give out to collect rainwater that you can then use in your garden. Or I would say just check and see what kinds of initiatives are happening in your community that you might want to get involved with, or if there's any. I think that would be a good start, actually.
Mm-hmm. And if you want to engage in writing letters to the editor in local news, of course, something like in the Boston Globe would be pie in the sky. It's very challenging to get an opinion editorial there, but really putting the word out about plant-based diets and how, for example, the U.S. diet contributes significantly to climate change and carbon and greenhouse gases.
Thank you. And you'll see that in the chat, I had provided the email address to the Blum Center. Dr. Bricky had provided some wonderful resources in her slide deck. So if you're interested in the resources that she shared today, feel free to email the Blum Center at pflc@partners.org, and I'd be happy to share that as well. So I think that's all the questions that we have for today. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
We look forward to seeing you in March.
Great. Thank you so much, everyone. As I had mentioned, today's session is recorded. If you're interested in viewing the recording, it will be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of
Thank
the day.
you. Thanks, Amy.